I think we should be good.
Okay. Well, good morning, everyone.
Morning.
We used to joke when I was at PSHA before that whenever it rained, the water would get into the lines and cause internet problems. So maybe that's what's happening today. But thank you to everyone who's here in person and for those who are online for joining us today at the very first Interagency Collaborative to End Homelessness. So thank you for the members who are here today for your participation. And I also want to thank the DSHA team that's here today. Mostly wandering around still, some over here in the corner. And I don't know, I was reminded of Patrick Swayze and Dirty Dancing when we put all the kind in the corner. But thank you all for being here. And before we get started, I also just wanted to remotely thank Governor Meyer for this executive order to put this group together. And as you know, most of you probably know his background at Newcastle County and his passion and attention to the issue of homelessness through the pandemic with the creation of the Hope Center and other ways throughout his time in Newcastle County. I think that's carrying over to his time as governor. So Executive Order 8 is the executive order that formed the Interagency Collaborative. And just in brief, what that executive order asks us to do is to, number one, review the homelessness system that we have here in Delaware and analyze its impact, to consider opportunities for consolidation of those services, and to identify gaps and make sure that we are advocates for filling those gaps as we move forward. When I talked to the governor about creating this executive order, his first response was, I don't like task forces. I don't like councils. A lot of times they get together and they talk about things, and I'm reminded of Secretary Cindy Martin's this point somewhat famous saying of, we're done admiring the process. And so this group is going to do its best, I hope, to not admire the problem any longer, although we will start soon with a little bit of data just to level set where we are. And I suppose that isn't admiring the problem too, but we're going to do it for about 20 minutes or so. I hope that this group is a framework for us to have state level conversations about homelessness. The history, when you look back, 10, 15 years, 20 years ago, we had an interagency council on homelessness. And around 8 years ago, that group stopped its meetings. And I think partially because we also have a statewide continuum of care here in the state of Delaware, which is unique. In most jurisdictions, larger states, those continuum of care groups cover the regions of the state, but in Delaware, it's a statewide continuum of care. And that group is tasked with making sure that federal funds that flow into the state are allocated appropriately throughout the system. Those federal funds right now total around $11 million a year. But when we lost the Interagency Council on Homelessness, we lost the conversation at the state level, the coordinated conversation between state agencies. And so partially this is, and when I say state agencies, I also mean our friends, the counties and the cities that are active in supporting the homelessness system through different ways. But we lost that conversation. And I think it's really important because the continuum of care is focused primarily on the federal funds and has a wide representation of service providers and state agencies and local governments, advocates, and others. But we lost that conversation really just between the government funders. So when I look at this group and its composition, I think that we have an opportunity to do a couple of things. One is to obviously do what the government wants us to do, making sure that our system is coordinated and collaborated between the state agencies and local government agencies, and how we are supporting the homelessness providers and service providers throughout the state. But number two is in this climate of uncertainty with the federal government, that we also have a state level group that is there in the event that we lose some of the leadership and some of the funding at the national level. So those are the things that I think we are tasked with first here in this collaborative. And I want to say that we kept the membership relatively tight. We have 15 members, and they're all with only two real exceptions, government entities that have a responsibility of receiving and distributing homelessness funding, and along with that funding, homelessness policy. The two exceptions are the chair of the continuum of care, which is important for us to coordinate with that group, and also the housing. That's a big responsibility at the through the federal level, with data and operations of certain parts of our homelessness. So that is my sort of quick introduction of where we've been and where I hope we are going. I wanted to let's see. I wanted to just sort of talk a little bit about what we hope to do today. So first, we will have that level set sort of data presentation from Rachel in the Housing Alliance to give us an idea for where we are from the numbers perspective. Alex, he's the Director of Policy and Planning at DSCHA, will give us an even more brief overview of the housing needs assessment information. When I think of homelessness, I think of it as part of the continuum, not the continuum of care, but the larger continuum of housing in Delaware. And so I think it's important for us to understand where we are on that front. We did ask for you to come prepared to discuss a little bit about what your jurisdiction or your agency does when it comes to serving the system of people who are experiencing homelessness. And then we have some time just to talk about how this group wants to act and some of our next steps. So let's start first, before we get to the data presentation, with some introductions. And let's start.
Leave. Yeah.
We never
Good.
Okay. All right.
Michelle Seaton, I'm with DSHA Policy and Planning Division in the Supportive Housing.
I'm Stephanie Griffin. I'm with the Delaware.
Emily Cunningham, Chief of Delaware State Housing.
Rachel Stucker, Director of Housing Alliance Delaware.
Brady Nallman, Director of Community Development Housing for Sussex County. I'm proxy for Todd Lawson as County Administrator.
Hey, I'm Susan Ken. I'm the Director of Better Homes of Seaford, but I'm also the chair lady of the Delaware Continuum of Care.
I'm Steve Gateman, Secretary for the Delaware Children's Department.
Good morning, Josette Manning, Secretary for DHSS. Good morning, Tara Taylor, Commissioner of the Department of Corrections.
Good morning, Brady. On behalf of Secretary Cindy Martin, I'm the Bikini Bento State Board.
Good morning, I'm Carrie Casey in Newcastle County, and I'm here on behalf of County Executive Marcus Henry.
Good morning, Patricia Moultrie, Secretary of Labor.
Kenny Chief Staff, the Mayor of City Hall. Good morning. Robin Christensen, Mayor of the City of Denver.
Morning, Kevin Sippel, County Administrator for King County.
Also Director of Public Relations.
Austin Ziegler, the Director's Office, Executive Secretary tonight.
And I'm Karen Miller, teacher here in Delaware. Listening in.
Hi, I'm Alex McGay, Director of Policy and Planning at DSCHA.
Hi, I'm Michael Daniel. I'm a service support specialist on the ETL team for DTI.
Quite sure how to do introductions for folks who are online. Okay, got it. That sounds good. Would
Ashley, Mike, do you introduce yourself, please?
why don't
It just got them.
can you
Yeah.
yeah, please, if you're on the line, if you could just introduce yourself, I don't know your name in the chat, that would be great. Okay, so let's start.
Louder, please. That was.
I think we're not turning our mics on.
Hit the mic, make sure it's flashing green when we're talking. I'm talking. I get it, make sure we're red.
Okay,
Red is blue.
all right. Hopefully that works. And you all can hear me. Okay. Let's go into the quick data presentations. We have about 45 minutes, I think, for this portion. And Rachel will give us a quick overview of homelessness in Delaware with some time for Q&A at the end. And then we'll go through the housing needs assessment as well.
Okay. The mic is blinking green. All right. Perfect. Okay, so I have a lot of data that I'm going to share. Not all of it is for the purpose of really digging into and understanding today, but just so that y'all have it. But first I want to start, there are two really main sources of data about homelessness that we can pull from. Both have their benefits and drawbacks, just so you understand kind of what we're looking at. Our organization is the Homeless Management Information System lead for the state of Delaware, Continuum of Care. And so we have HMIS data. In Delaware, we call it CMIS. If I say CMIS or HMIS, they mean the exact same thing. And then we also do the annual point in time count. The point in time count has some benefits because it includes all programs and people experiencing homelessness, regardless of whether or not the data about those folks is being entered into CMIS by providers in the community. It is a snapshot on one night in January every year of homelessness, which allows us to see trends over time. And we implement it using the same methodology every year. So again, that allows us to see trends over time. We know that it's challenging to count and understand how many folks are unsheltered in the community at any given time. And so we always assume it's an undercount of people who are sleeping outside. So that's one of the drawbacks. It really can only include basic demographics. And it also only counts people who are Category 1 homeless per HUD's definition. Basically what that means is people sleeping outside in a place not meant for habitation, like a car, an abandoned building, a park, a tent, a bus stop, or sleeping in a homeless assistance shelter or temporary program. So an emergency shelter or transitional housing program specifically for people experiencing homelessness. It does not include, neither does the CMIS or HMIS data, include people who are in recovery homes, like Oxford houses, group homes, who are in a recovery home of some type, and may have also experienced homelessness. The HMIS data that we have is much more comprehensive than the PIT data. We can see where people are flowing through the system of care during the year. People are entering and exiting programs. So it's really more real-time data throughout the year. But it's limited to entities that are putting data into the system. Some of the largest entities that aren't, that are serving people experiencing homelessness that data does not capture includes domestic violence programs and shelters. People who are experiencing unsheltered homelessness, we get some data from some of our homeless outreach providers, but that data is limited to our limited formal homeless outreach providers, state service center motel voucher holders. If they're not being temporarily housed at the Hope Center, they're not included in the data. And the Sunday Breakfast Mission, which serves more than 200 people a night. That data is also not in CMIS on an ongoing basis. So those are some of the benefits and limitations of the different sources of data. So that said, I want to share the point in time data for 2025. Again, this is that one night snapshot. The homelessness increased from 2024 to the 2025 PIT by 16%. From 23 to 24, there was a 9% increase. And you'll see in 21 and 22, the number shot up quite high. We know that was because during the COVID-19 pandemic, there were a lot more resources for temporary shelter made available to people experiencing homelessness or people at risk of homelessness. So folks who were staying in the hotel motel program, there were temporary COVID relief funds to keep them there for long periods of time. And so the number of people temporarily sheltered in homeless assistance programs ballooned. There's been some analysis on that. There's an actual report on it that was done by the University of Delaware that really does show that we know the reason it went up was because more people were having a housing crisis and were temporarily sheltered. So it's kind of like a blip, but a blip that shows us that the need for housing assistance is much greater than the resources that we have. And when we make more resources available, people need and will take advantage of them. So in some ways, it gives us an even greater insight into what the need is, if that makes sense. We also have seen unsheltered homelessness go up quite a bit over the last couple of years. Last year was the largest unsheltered count ever in the state of Delaware in 2024. In 2025, all of the cold weather shelters were open across the state, including in Newcastle County. That has not been true for many years on the night of the point in time count. It was the first time in years. And so in the city of Wilmington, for example, in 2025, there were over 40 people sheltered in a cold weather shelter up at one of the churches in the city. And in Newark, there were over 20 people sheltered there who would have otherwise not had shelter. And so when we see the decrease in the unsheltered number, that 167 in 2025, we also know that there was a lot more shelter open in Newcastle County that night than in prior years. Right, so the data can tell us some things, but changes in the system also impact the numbers. All right, so this is PIT data, but a lot of this is really the same every year. Maybe not exactly the same, right? But for example, when we look at the types of households that are experiencing homelessness on the night of the point in time count, it is almost always true every year that it's about 20% of the households are households with children under the age of 18 in them, and about 80% of the households are adult-only households. So that could be a single person, that could be a grandma and her adult daughter, who are both adults. It could be a couple that are both adults, but that's adult-only households make up 80%, 20% adults with children. That's been static for many, many years. 44% of adults on the night of the PIT reported having a disabling condition. That also between 40 and 50% is every year. Same number, floats between 40 and 50% of adults have disabling conditions who are counted in the PIT. We also see that in the CMIS data. So we know that about half of adults report having a disabling condition of some kind, which includes physical, developmental, behavioral health related, etc. Gender, this includes children. So it's usually about between 50 and 60% male, 40 to 50% female. Age, what we have seen over the last number of years is actually an increase in people over 55 and people under 18 experiencing homelessness. This is the largest count of people under 18 experiencing homelessness ever. In the 2025 count, 27% of people were children under the age of 18. And the other 25% roughly of that whole half of the population were adults over the age of 55. When we look at race, has stayed pretty static over the years for many, many years. Approximately 60% of people, again, including children experiencing homelessness, identified as Black or African American. And then you can see the rest of the numbers. So we know that certain groups of people are more impacted by the trauma, the instability that homelessness can cause. I will say this won't necessarily add up to 100 because people can select more than one race. And then we also see since 2018, the number of veterans experiencing homelessness starting to go back up. The chronic homelessness number is very complicated. I don't know what to tell you about it other than it kind of goes up and down. A lot of it's based on the quality of the data that we get. So I'm not as confident in that data because it has to do with how long people have been experiencing homelessness and whether or not they have a disabling condition and those things combined. So it can be a bit tricky if it's based on self-report, if it's based on surveys that are being done in the streets, right? That can be hard to understand. But chronically homeless numbers, either way, I would say, are way too high. By county, again, this has stayed fairly static for many years, usually about and pretty consistent with population across the counties. So usually it's about 60% of people in the Night of the Pit are Newcastle County, 20 in Kent, 20 in Sussex. What we've seen over the last 3 or 4 years is the numbers in Sussex consistently increasing and going above that 20% of the count. One of the things that we also do is take an annual snapshot of what types of resources are available in the system for people experiencing homelessness, called the housing inventory chart. But that's that homeless assistance bed types. So again, this is something else we could dig a lot more into. We could look at where they're located in the state. We could do a lot with this data. This is just a snapshot to show the types of resources that currently are considered to be a part of the homeless assistance system, how many shelter beds we have, including hotel motel beds being paid for by the state in the hotel motel program. Including all of them, Sunday breakfast mission, domestic violence, right? This is the PIT data, so it includes all of the bed types. Transitional housing, rapid rehousing, permanent supportive housing, and other. So that's the PIT data in a snapshot of 2025. And again, I'm not going to read through this whole chart. Don't worry, Matt. But I wanted to let you know the types of data we can get so that you all can think about what might be useful as we move this forward. We've started to pull these monthly snapshots of what's happening in the temporary shelter that is in CMIS, which isn't everything. How many clients are being served, how many households are being served, where they're coming from. There are some demographics, gender, race, household type, and then where folks are coming from, the type of living situation they're coming from, and where they're going. So I'll just bring your eyes to the bottom right-hand part of this chart, where it says living situation prior to program enrollment and exit. Basically what that's telling us is when people are coming into shelters and transitional housing programs, 48% of them are coming from what we would call, and again, we could talk about all this in more detail another time, but a homeless situation. About 9% are coming from an institutional setting, about 13% directly from some type of permanent housing, and 30% from some type of temporary living situation, usually with family, friends, doubled up situations, something like staying on someone's couch, something like that. And then where are they going when they leave those programs? About 30% are going back to homelessness. Sorry about the dots there, that's a number. 16% going to permanent housing, and then about half of folks going back into some type of temporary situation. Again, family, friends, couch, something like that, or maybe even going from one shelter to another. So we see that a lot in the system, folks staying from the shelter, going to the shelter, going to the shelter, because a lot of the stays are brief, and that's not enough time often for people to stabilize and find housing. We also run a total kind of system dashboard. This is for the last 6 months through March 31st. But this is similar data, but just gives you a sense if you're looking across all the project types in the system, rapid rehousing, permanent supportive housing, the street outreach programs that are entering data into the system, just how many folks were assisted in these projects and what was the demographics of those folks. It includes what's in CMIS, includes, I should have said this, includes data from that are includes information and data about people being served in VA-funded homeless assistance beds that serve veterans. And so you can see about 576 veterans were assisted in the system during that time period, children, youth, elderly. So again, this is just want you to see what we can pull and the type of data that we can get that might be helpful to you. One of the other things that we can do with CMIS data is look at some what we call system performance measures. So what are the types of outcomes that we're getting when people are being served in the system? And these are the main ones that we would look at. These are prescribed by HUD. It doesn't mean these are the only things that we can look at, but these are the things that at this point we've been tracking for about 4 or 5 years in Delaware. So how long are people remaining homeless? How many people are returning to homelessness after? So someone becomes homeless, they move out into permanent housing of some kind, whether that's I'm going to go stay with my mom for the next however long it takes me to, I'm staying there permanently. It could be I'm renting a unit with a voucher, any type of like permanent housing. How many of those folks are coming back to homelessness within the next 2 years? That's what we consider a return to homelessness. We can look at how many people's income is increasing as a result of being served in a homeless program. How many people are new to homelessness, meaning the way that we look at that is how many people are new to the system, have no entry into any program over the last 2 years. That number is pretty high, and it's always pretty high. It's usually between 70 and 80% the last number of years of people that experience homelessness in any given year have not been homeless over the last 2 years, are new, falling into homelessness. And then we can also look at how many people are leaving certain programs to permanent housing, which is ultimately, right, the goal is to get people out of homelessness and into stable housing. The last thing that we can do is look at centralized intake data. So that's people who are reaching out for help is really what that represents. It doesn't mean that these are the only people that need help. And there are a lot of different ways that people reach out for help, but people who reach out for help through the 1833 Find Bed number, we can look at how many households contact us. We can look at how many calls we get. How many households that contact us are in need of homeless assistance, right? We get a lot of folks who contact us who are at risk of being evicted, at risk of homelessness, don't really want to go to shelter. They need another apartment. They want someone to help them find like a rental subsidy or something to help pay rent. Lots of those calls. But for example, in all of 2024, there were over 7,000 households who contacted us who, based on our assessment, were in need of homeless assistance resources. All right, so that's shelter, transitional housing, temporary shelter, like in urgent need. The one thing that I think is most interesting about this is the household, where their living situation was when they contacted us. So if you look at that middle graph, 44% of those households who contacted us at some point during the year, because people call us multiple times a day, multiple times a week, once a month for a whole year, at some point reported to us that they were in an unsheltered situation, which is huge. And it may have just been for one night. I'm in my car with my kids for this one night. The next day I make it to my mom's house. But that's a lot of people that at least for one night throughout the year, and for some people it's going to be every night, are experiencing not having a safe place to sleep. And then you can also see how many people at some point during the year reported that they were in some type of temporary shelter. The doubled up number is also huge, right? We know a lot of people have housing needs. They're not necessarily being served. They're not necessarily on the street. They're not necessarily being served in shelters, but they are in an unstable living situation. So that number is almost at 40%. At some point reported that type of living situation. And so we can look at this data in a lot of different ways. Yes.
With the centralized intake, do you have data that says how many calls were received, like the need was here, how many residential housing placement was made, or if not, why were they disqualified?
Yeah, so yes. So if you look at the left, 7,000 households reported a need for homeless assistance resources. Less than 1,000 unique households were referred to homeless assistance resources. but I have to qualify that a lot for it to make sense. You can find this data on our website, and there's a whole second page that explains the different like data points and what they mean. So let me qualify that. When we say referred to a homeless assistance resource, we don't mean like told, hey, here's something that might be able to help you, give them a call. We mean there was an open resource that that person was eligible for that we were able to match them to.
So he's like out of over 7,000, less than 1,000.
Yes. I will also qualify that by just saying that we don't refer to all the resources that exist. So some of those other households probably got assistance from somewhere else maybe, right? Going through the state service center, hotel motel voucher program, showing up at Sunday breakfast mission and being able to sleep there for the night, like those, right? So this is limited to the resources that we have that direct partnership with. So it's a little bit of a, it's the best we can do and the best we have, but it's not fully capturing the entire system. So
Yeah, to learn more about if somebody was not placed, if disqualified for some reason, what's that reason? And then to me, that would be an identified population that we should look into. For example, I was a probation officer for 20 plus years. I was sex offenders for 10 of those years, and finding shelters and housing for that particular population was almost impossible.
Yep.
So I get why, but I think we need to do better, or at least think of other ways to do better.
Yeah, yes. And there are a lot of reasons why someone might not get access to the resource, even when it's available, if that's kind of what you're getting. So even when there's a resource available, why is someone not getting it? Yes, we can anecdotally talk about a lot of that. I mean, sex offender status, there's only one shelter that will accept, right? We could go through all, there's a lot of reasons. Transportation, we have them all. We can go through all those. There's a lot of reasons.
Backup Commissioner Taylor, from my understanding, there's 10 vouchers made available for reentry coming out of prison.
DOC has 10 vouchers, but those for the most complex cases. But there are other resources that we work closely with, but we have 10.
Is that, when you say voucher, do you mean hotel voucher? Okay. Okay, so without going into all that, the big story, which I probably could have just said at the beginning, but I wanted you to at least see some other data, is that homelessness has been going up since 2019. There are many more people in temporary and unstable living situations who are at risk of homelessness than we count as homeless, or that are able to get help from the system of homeless services. And the most impacted groups, people with disabilities, Black people and Black families, and 1 in 4 people is a senior and 1 in 4 is a child under 18. So those are some of the big takeaways in terms of who's being impacted. And that's it for me. If there are other questions, yes.
You have more data breakdowns on disabilities.
Yes, but there will be a large chunk that is unreported. So we can provide that if that's something of interest to this group, but there will be a lot of folks who have a disabling condition recorded in the system as yes, but no more detail. So it depends on the quality of the data. We could get more. There just will be a chunk of data missing.
Yeah, I think that our making decision, we're worried about what population.
Yep.
There's a big difference between an IDD population and substance use population or maybe other behavioral. So
Yep.
that's kind of where we're going with that.
Yep, absolutely. Yes.
Are you going to go back to the things? One thing. Income growth. Can you talk about that?
So yeah, this one is specifically hard to, okay. Yes, I can talk about that, sorry. So this is specifically only for projects that are COC funded. So continuum of care funding does not fund homeless shelters. Temporary shelters, street outreach, none of that can be funded with continuum of care dollars. The continuum of care dollars are funding some transitional housing projects. I think we're at about 2. Most of it is rapid rehousing and permanent supportive housing. So just to qualify it that way. And it's a fairly low number. A lot of folks being served in PS. So there's a couple reasons why. Number one, we are always hounding people to update their income information in the system. So it's not the best recorded data. But I also think it's probably about right for these types of projects because a lot of people served in permanent supportive housing, which has much more people than rapid rehousing. Those people have disabling conditions. Many are on fixed incomes, SSI and SSDI, and have limited opportunities to increase their income over time.
Just for clarification, so when someone talking about the referrals from centralized intake, when you're referring folks to open resources, the 952, what about for the other individuals? How do those conversations go when people call? Are you providing them with sort of resources like a 201 type system, or because I think just to clarify for like, how do you want to explain sort of what those conversations, like, what is it like when someone calls centralized intake? Because as you said, many of them, you're talking to them several times, right? So what are you providing them with if there is no available resource?
Yeah, so the conversation depends on the person's situation. So for example, if it's someone who's been sleeping outside for a really long time and they're just calling to see if that shelter bed at that one shelter that they want to go to is open, it can be a pretty brief conversation and we probably know them pretty well. Or it can be someone who was told to call us who's never experienced homelessness before, and then it's a very different conversation. So sometimes it's literally just like, hey, it's Mary, I'm calling to make sure I'm on the list today for shelter. And we have all her information and we've had it for 4 years. If it is someone who needs to know about who isn't yet necessarily homeless, but is at risk of homelessness, the conversation, we try to let people know about other resources that are available. But those resources are really, really limited. So of course we always say, a lot of times, sometimes it's a direct transfer from 211, they'll direct transfer people to us. So we know that they've already talked to 211, but yes, we definitely are. Have you contacted 211? They might know of other resources in the community that can provide you with some support. Have you visited a state service center? That's where you can get help with benefits that may be able to help you, or find out if you're eligible for a voucher for the hotel motel program. When there is rental assistance available, a lot of folks are calling us for that reason. And so we'll try to let them know where those resources are, like the housing stability program that just closed but was open for a while. There are also other organizations that get homeless prevention money. So we'll tell them about those as well, like Lutheran Community Services, Catholic Charities, Salvation Army. A lot of times what happens is we can't guarantee there's a resource on the other end though, because those funds will come and go super, super fast. Like the Salvation Army recently got a bucket of money to provide like utility assistance. It was gone in like 2 weeks, right? So it's kind of here's some other phone numbers for you to try conversation. I don't know if that's helpful.
One other question, I'm pretty sure the answer is no, but do we have any housing resources, shelters that are underutilized?
So we definitely, that's a great question. So shelter capacity in the shelters that we refer to and that are in CMO, actually we can, so something like that. It's definitely true if you're not at 100% capacity in the congregate shelters. So like the ones you're thinking of, like not the hotel motel voucher program, they're definitely not at 100% capacity. There are a lot of reasons why that aren't necessarily just because people aren't getting in. So for example, I can start listing off some of the reasons, but we could have a much longer conversation about it. We might refer someone to an open bed and then they can't get there and the bed stays open, or they last minute, their cousin says, actually, you can stay with me. And of course they'd rather stay there than at the shelter. There are issues with staffing and turnover at the shelters. Most of the shelters really, really struggle just to pay the bills and stay operating and keep staff on site. And so a lot of times what will happen is someone will vacate a bed or a room and it takes some time to clean and turn that over. So we definitely have, like, some of the shelters we will refer to and they're scheduling intakes out like 3 days later because of staffing issues. So then that bed's sitting open, or that room for that family is sitting open for 3 or 4 days when someone could be occupying it. But again, it's a different issue. Someone might be eligible, what we would call eligible for a spot in a shelter, but they were there a year ago and the shelter had a bad experience and is not welcoming them back. And so then that bed's open. And there are certain shelters also that clients do not want to go to. We will offer them open spots and they say, no, I do not go there. I don't want to go there. So there's a lot of different reasons. Other questions? Yes.
If I may, Commissioner Taylor brought up the utilization rate. It's been my experience that there's a lot of people with vouchers that can't find a place. Do you track how many people have a voucher that can't find a place?
No, so that would happen at the housing authority level. We aren't able to send people directly to housing, like, well, now with the new online system, we can help people know how to get on the waiting list, but for the vouchers, but we don't manage the part of the process. Carrie, I think you just popped your hand up.
I would say with our housing increase voucher program, about 41% lease up. Because they're, even with the voucher, they're not able to access housing because landlords and the lack of affordable housing and the competition. So yeah, it's a huge issue. We try to be competitive. We offer a really good rent. But it is really hard for folks after they wait on the waiting list for 10 years to get the voucher, and then it's really hard for them to find out.
One other thing is you mentioned some people don't want to go to some shelters. What's the accountability because they're strict. And I come across a lot of places where people are being housed, like the vomited veterans, or 2 to 4 people in a bedroom. There's a place down Delaware, the place looks like beds are like 3 feet apart. And it just seems to me like there's a lot of money going to a lot of people. I mean, like hope so. Hope I don't have one person in a room. Excuse me?
A household, yes.
Yeah. And I mean, it just seems to me like there's a lot of money going out and the services aren't being provided. I have to go pick guys up, take them to Social Security, whatever. And the money's there, it's just not being utilized properly.
I just want to say that information here.
Yeah, I mean, I could talk about that for 10 years and I won't.
That's what I'm hearing. Any other questions about the data presented?
If there's one thing, make it great. So you talked about the category 1 homelessness, and assuming, from category 1, there's other categories, right? So sort of a continuum of it. Is there like a best practice that says you can go, like, what is the goal from, we've identified someone as a category 1 homelessness, experiencing that category of homelessness, to go from that to actually stable housing? Is it like 12 months, 24 months? Because typically, I think you mentioned a lot of mental health issues, there's employment issues, there's transportation issues. So what is, like, as we're starting to work towards this and to go from, you got someone at a point in time to someone that now has stable housing, is there a time frame? Because a lot of the things that you talked about with the data, right? It looks like 30-day stays, shorter term stays, vouchers are time limited, but how long does one assume that you need to spend working with a person or a family to go from category 1, first month's rent, last month's rent, insurance, get out of your utility arrears, right? Get your treatment concerns taken care of. Is there something naturally that people assume is the amount of time it takes?
So there is not an amount of time that people assume that it takes. So I think the best practice is to assume that it shouldn't take time and figure out how to make it take as little time as possible. So I think one of the things, so the way, so for example, communities that have made a lot of progress on reducing homelessness have very intentionally, because of issues with shelter capacity, because of issues with congregate stays, and for example, someone who is schizophrenic may or may not really love staying in a room with 100 other people, right? Go down the long list of why shelters work for some folks and not others. They've really focused on how do we create the quickest path from the street or the shelter directly to housing. Like, that's really the focus of their work. And they've had success at doing that. It's about creating the resources to make that happen as quickly as possible. What you see happening, what I would say, from my experience, what you see happening in Delaware and in a lot of places is that people are getting stuck in the homeless system for far too long because the resources to get people out and the housing to send them to does not exist. Right? So there's not enough first month's, last month's rent. There's not enough rental assistance. There's literally not enough housing units. And so people are getting stuck longer. than they should if those resources were to exist. I think the other really important thing is that people shouldn't have to go to shelter or temporary housing in order to get a permanent housing resource. And so creating that pathway from the street directly to housing is an important part of it.
I think that's a great question. And again, big part of why we're here. So let's move on. I want to make sure that we get through this part and then we have a really pretty open part of our agenda later on to dig into some of these things. I wanted Alex to give just a quick overview of our housing needs assessment. One of the things that I've observed as I traveled around, especially in my last role at HUD, looking at sort of regional and national examples and jurisdictions, is the areas where housing supply and the crisis of housing supply, the shortage of housing supply was most acute. You saw increases in homelessness. Where housing supply efforts had been started several years ago, places like Minneapolis and Austin, we see the opposite impact, where housing supply comes online, prices stabilize, prices come down, more units are available, and you see decreases in homelessness. So it is all related. I think that it's important for us to say that homelessness is a housing problem first. I think that we haven't always sort of taken that perspective, but homelessness is a housing problem first. There are other things that obviously we need to attach to our services and our thinking about how to serve people. But getting them housed is one of the quick answers. And housing supply is related to that. So I wanted to make sure that we had some perspective on the housing market, the housing supply overall. And that's really out of our housing needs assessment. I'll also say that I want to make sure as we start our work that we don't get lost in housing supply as something that we work on in this group. There's a lot of effort going on around housing supply. It is a big issue. And I want to make sure that we think about homelessness, that we acknowledge that that's part of our solution, but that this group isn't necessarily the best positioned to try to have an impact on housing supply overall, that we really focus on the homelessness system and how we can move people through it into whatever housing supply we have available. Okay, Alex.
Thank you, Director Eccles, and thank you, everybody, for two things. Your patience with the technology, really appreciate it. And then as well as thank you for your commitment to the issue of homelessness. Really appreciate the mission of this working group and excited to work with you all. And Rachel, appreciate your overview of the state of homelessness in Delaware. As Director Eccles said, I'll be kind of presenting different perspectives with this issue, essentially how housing affordability and housing supply shortages are linked to homelessness. Get started. I want to start with some general definitions that I think will just help as I go throughout this presentation. And those three definitions are affordable, cost burden, and fair market rent. When most people think of affordable housing, they think of rental subsidized housing or public housing. But affordable, with the definition that we use, is a measurement relative to a person's income. So affordable means that the combined rental and utility costs, mortgage, property taxes required, and insurance do not surpass 30% of a household's gross annual income. And so someone or a household who makes between 0 and 30% AMI, if their housing costs annually do not surpass 30% of their annual income, that is considered affordable. If a person over 120% AMI is not paying over 30% of their annual income on housing, it's considered affordable. And so it's just important to make that discrepancy as we talk about affordable housing in this presentation and throughout the course of this course. I want to talk about, so I mentioned that 30%. Now, essentially, if you're paying for over 30% of your annual income on housing per year, you're burdened. You're considered cost burden. And so when it's over 30%, that housing is no longer considered affordable to you. And that's along all income levels. And then severe cost burden occurs when a household or individual spends more than 50% of their income on housing. And so you have those two different levels of cost burden there. And then fair market rent is the third term I'd like to define. Generally calculated as the 40th percentile of gross rents for regular or standard quality units in the local housing market. It's a very technical definition. Essentially, what it's seen as is an estimate of what a family moving today can expect to pay for a modestly priced rental unit in a given area. So that's kind of the technical definition. This is kind of just generally what people see it as, and it changes from local housing market to local housing market. This is a level that is set by HUD and calculated by HUD. So I'll be getting into a little bit on fair market rents. Right, so as Director Eccles mentioned, we'll be talking about the housing needs assessment. I'll also be referencing some data and research from the National Low Income Housing Coalition. And we'll dive right into it. And we'll first start with the renter's perspective. And so our housing needs assessment that we did in 2023 showed that overall in the state, 50% of renters faced a cost burden. And so what we did is we looked at data from 2010 and when the data was collected in 2021, and we found that there was an increase of 11,000 more renters who were cost burdened in Delaware, which represented an increase of 26%. And this increase in rent burden was shown all across Delaware, across all counties and cities, except for Newark, where the change was minimal. But all other cities and counties showed that renters are really struggling to pay rent. They're paying well over 30% of their annual income on housing costs. And then talking about the most financially vulnerable, the ones who, the households that, would be susceptible to housing instability, insecurity, homelessness, 70% of extremely low income renter households have severe cost burden. And so you compare that to the overall 50% cost burden among all renters. Extremely low income renters are disproportionately affected by rental costs and housing costs. And as I'll continue to explain throughout this presentation, there's other trends going on in the housing market that are really constraining not only their ability to afford safe and adequate quality housing, but their access to it as well from a supply standpoint. So I mentioned the fair market rent calculation that HUD does. And what they did is they found what the fair market rent for a one-bedroom apartment in Delaware is and what the fair market rent for a two-bedroom apartment is. I'll give you those numbers on the screen. Fair market rent for a one-bedroom apartment in Delaware is $1,310. Fair market rent for a two-bedroom apartment is $1,594. And what they did with this fair market rent level is they calculated what would a household need to make to be under that 30% annual, or what would they need to make to not go over 30% in housing costs in terms of their annual income. And what they found is that a household would have to make $52,000 to be able to affordably, rent a house in Delaware at fair market rent, and particularly a one-bedroom rental home. When we look at what the fair market rent is for a two-bedroom rental home, the annual income required is $63,742 to stay under that 30% level in terms of their income, to not pay over 30% of their annual income on rent. Now, when you calculate that on an hour-to-hour basis, as far as what would they need to make per hour in order to comfortably afford a one-bedroom one-bedroom rental home or two-bedroom rental home, they would have to make $25.19 an hour to afford a one-bedroom rental home, and they would have to make $30.65 an hour to afford a two-bedroom rental home at the fair market rent level. And so comparing that to what workers make in Delaware at minimum wage, they make $13.25 an hour. So you do the math, Each week, a person making minimum wage in order to afford a modest one-bedroom rental would have to work 76 hours a week. In order to afford a two-bedroom at fair market rents, they would have to work 87 hours a week. And so, you're finding that people are having to work obviously 2 to 3 jobs to be able to just comfortably hit that 30% mark in terms of not paying over 30% of their annual income on rent. And so that's a little bit on affordability and the concerns on affordability. It's one thing for there to be concerns with affordability, but begs the question: do we have the units at all these different income levels where those people can occupy housing? And what we see in this graph that we did in the 2023 housing needs assessment is that it's not necessarily the case that we have a gap in affordable units. And so I'll explain this graph, and I want to alert your attention to that 0 to 30% AMI category. What it shows is that we have 22,348 renter households in Delaware that have incomes between 0 and 30% AMI. They need rental units, according to that income, that are at $498 a month or less. What this shows is that there's just 8,730 units in the state that are available to rent for less than $498 a month. And so you do the math, you get a gap of 13,617 units for these extremely low income households. You see it with the 31 to 50% AMI level as well. You have 17,000 renters. They need units between $498 and $830 a month to meet their affordability needs. And you see a gap of about 5,816 units. And then you go all the way down to the bottom, and you see a shortage shown for higher income renters. This is renters 120% AMI and above. This gap is not necessarily a housing need, but what it shows is a mismatch in income where higher income households are occupying homes affordable to lower income households. And so what happens is this causes lower income renters to compete for a smaller number of units. It pushes everybody down, right? So if there's not units for people above 120% AMI, they occupy housing that would be affordable to people at lower income levels. And what it does is it squeezes the people at the bottom the most. Those people at the bottom income levels between 0 and 50% AMI, they're already struggling to sort of compete and find access housing. And so when all these different levels, everybody's sort of down renting, it constrains their ability to access housing even more. And then on the homeownership level, the burden is not as severe as with renters. Our housing needs assessment showed that about 22% of homeowners are cost burdened and 9% are severely cost burdened. And then, although you see foreclosure rates declining, low-income homeowners and seniors remain at risk, especially in areas with high housing cost burdens or stagnant wages. And then I just wanted to also mention our housing needs assessment looked at the homeownership gap as well. Around 75% of white households own homes, compared to only 48% of Black households and 40% of Hispanic households, reflecting persistent racial disparities in access to homeownership. Everything from redlining to the legacy of segregation. And looking at this gap with access to homeownership, you see a similar gap existing along racial lines in the demographics of the homeless population. As Rachel mentioned, 62% of the homeless population in Delaware is Black versus 33% of the white population. So you see disparities around racial lines as well. Just want to end on this point, and this was a point brought up by Director Eccles earlier. There's a lot of contributing factors to homelessness. Drugs and alcohol, mental health, poverty, unemployment. But there are certain trends, and I'm not here to refute any of those circumstances leading to a household or person's homelessness. But there are trends going on in the housing market that are also, affecting a household's ability to access housing and stay in housing. There's a study that the UCLA Housing Center highlighted by Greg Colburn. He's a writer and researcher. And he did an analysis of all the different cities in the US. And what he found is that cities or places where drugs and alcohol, like the opioid epidemic in West Virginia, he expected homelessness rates to be very high there compared to other cities. And what he found is that they're not. Places where poverty is really high, such as Cleveland or Detroit, he expected homelessness rates to be very high and growing and increasing. They were not. The fastest growing places where homelessness is vastly increasing are places like New York City, Los Angeles, San Francisco, the state of California, Seattle. Incomes are high in these places. However, they cannot keep up with the dramatically high level of rents. And so, there's a lot of different issues that can lead a person to housing insecurity and homelessness. And I think, there's a lot of research coming out that there's trends in the housing market that are certainly coming to the forefront, that are scratching the surface in terms of, places where housing markets and lower income people are very constrained, are sort of feeling it the most. And so starting to kind of see this in Delaware based on this data and research as well. So thank you.
Any questions? And I'm thinking about it for the folks who are online, as you're asking questions, tell them who you are. Sorry, or I'll tell them who you are.
Saran K, City of Wilmington. I was just curious as to whether or not you guys had data in this presentation that kind of showed geographically where some of this is contributing the most. One of the things that I guess we're seeing surrounding Newcastle County, the impact of the lack of affordable housing outside of the city of Wilmington. What impact does that have on the demand in the city where there are a good amount of affordable, not even available affordable units, but there have been development of affordable units over the last decade and some change, and the impact that has on our city?
Yeah. I didn't kind of get into the county city level data, but we do have that. I'd be happy to send it to you. We have it for all three counties, and then Wilmington, Newark, and Dover.
Very appreciative.
Thank you. Thank you.
So my name is Joe Walls, Veteran Services. How come we're not utilizing the voucher ownership program? I talked to some of the housing agencies and they said that program hasn't been used in years. And what it does is like Section 8 vouchers, rather than paying rent, they pay mortgage for 15, 20 years. You get people in the permanent housing, that solves their problem for that.
For my time at WHA, that is a program that's being used.
And same with us. Newcastle County has a group of home ownership section. We do. Our Section 8 home ownership.
It's, yeah.
So I think that's more of an observation. I wonder whether or not it's accurate. What I tend to see in Delaware seems contrary to the data you presented. So there seems to be a lot of development of new housing, which appears to be more expensive based on the area. And I almost wonder whether the market will at some point correct itself. If the higher income households, they don't want that housing, that uber expensive rent.
And so that's one thing that I think, we're looking at on the housing supply side of this, another priority for the governor is housing supply. And again, I think because it's very linked, when you hear the governor say that the rent is too damn high, it's about cost of living and housing's contribution to families' cost of living. When I think of that problem, I go back to land use. I think for a long time, we were frustrated with developers because they were building in southern Newcastle County and eastern Sussex County, and they were building, generally 2,400 square foot homes on half an acre lot on something that used to be a field, a soybean field or a cornfield or a forest. And we were frustrated with that. But, the Affordable Housing Production Task Force that released its report back in April shows that it's really about what they can produce. And that goes back to local zoning and permitting and that process. So I think we need to maybe give builders a break and acknowledge that they are building within a system. And if that system doesn't change, then yeah, they're probably going to keep building expensive, spread out housing in most of this. There's been actually, you're right, a lot of development in Delaware over the past several decades, unlike other jurisdictions where there hasn't been a lot of building. The average home in Delaware is only 40 years old, which sounds kind of old. But when you think about Pennsylvania, that number is something like 76 years old. So that shows you how much new production has come online in Delaware. But again, because of sort of the system within which housing development has occurred, it is not serving families living in Delaware. If you think about where and what that housing production looks like, it generally is not serving families, and it is certainly not bringing down the cost of housing for families in Delaware. So that's something that we're looking at. We do need to change the way that the system incentivizes new development in Delaware. We need smaller units because smaller units are cheaper. We need denser units because density allows for us to not pave over too many more cornfields. And we need to increase the variety of housing. I think if we kept up on the production side where we are, we're probably producing at a pretty high level compared to other areas. It's just that we're getting out of that system housing that isn't supporting families. So I think your observation is right on, and I think it is actually borne out in this data where there isn't enough housing at those lower rent or mortgage levels. Newcastle County recently passed pocket neighborhoods that would give the opportunity for developers to create smaller housing units in a more dense setting that would be naturally more affordable. We're looking, the city of Milford is actually doing some really good stuff when it comes to creating smaller units. So it's happening in some jurisdictions, but not all. And that's an area where I think we do need to increase the production of what, if you look at this, hold on, this chart that's on the screen now, it's not just, but we've talked about the creation of affordable housing, and I mean subsidized housing. We're limited in how much we can do there. I think that what we've recognized over the last several years probably is that we also have to create a better market rate system, that this lack of supply in the market overall is pushing down. Alex talked about this downward pressure on people, the people who can afford those 120 AMI units. And if they're not available, they go and rent down in the income, in the rent structure, right? And so it is important for us to create higher income, higher priced units as well, if they're the right kind. So not $850,000, 5-bedroom homes on a half an acre lot, but more diversity throughout the system that's affordable to people throughout the system, and that will relieve pressure on the entire system, including trickling into how many units are affordable or are made available through the subsidized system. Because again, the people that are squeezed out of the bottom, as Alex said, are falling into, tax credit developments and places like that, and falling into homelessness, quite frankly. When a few months ago we had a convening in Dover, and a woman came up and talked to me, and she said, I've been a nurse my entire career. I was living on a fixed income comfortably, and then my rent went up by 20 or 30%, and I lost that unit. And on my fixed income, I couldn't find anywhere else. It wasn't that she didn't have income to pay for rent. She could not find a unit to rent, and so she became homeless. So, there is a change, and I think we see that in some of the demographics here too, where we're seeing more families become homeless. We're seeing more people who are sort of retirement age because of being on a fixed income, who are becoming homeless. And so the type of circumstances that are leading people into homelessness is changing as the housing market has become, on average, more expensive. And we're seing that in the data, I think, across the board.
One thing that the county has.
And you are?
New County County, is that I'm so, like, I have had a paradigm shift in my thinking. Because at the county level, we get a lot of NIMBYism, in my backyard folks, when we say we're building affordable housing. And like what Matt said, what we need to do is make building housing easier to do. And maybe not like trickle down housing. Eventually we'll get to those that are more, I didn't even begin to tell you, pocket neighborhoods. They were proposing one in Centerville, $800,000. And there were like 50 people that showed up against $800,000 pocket homes, carriage homes in Centerville. So we're dealing with a lot of pushback from the community members that don't want any, when you say affordable, oh my gosh, they come forward like Section 8 and neighborhood, no, so I think there's so many factors in that. But I think it's easier to build, and we don't call it anything, that eventually we'll get to those folks that we serve.
And again, I want to reiterate what I said before. In places where, because of circumstances, places like Minneapolis and Austin, Texas, because of the move of Silicon Valley into Austin, Texas over the past 10 years or so, really, they've had a housing supply crisis for a lot longer than the rest of the country. So in these little micro markets where or not micro markets, but sub markets where housing supply has been stressed and prices have gone up over time, they've also responded a little bit ahead of the rest of us. And so they've been building a lot of dense and sort of moderately priced housing in Austin, Texas. And so the housing prices over the last year have stabilized naturally. They've even turned down. It's become a buyer's market where landlords are even offering, moving costs or first month's rent or things like that to get people to take their units, which is creating housing is not immune to supply demand economics. And so that's really what we're talking about here, is creating enough supply that the demand, is where sort of the imbalance is created. And again, that has led to lower numbers of people experiencing homelessness in those communities. So it really does matter. I wanted to touch on this. I wanted to make sure that we sort of recognize that part. But again, I don't think that's a problem we're going to solve around this table. And there's the other thing about housing supply is that it's going to take some time. When we are successful, it will take some time for us to get there, just the building process and everything else on top of the time that it'll take for us to get there. So we do have to fix, the interim pieces before we get there. Any other questions for Alex? You've been a little easy on him. Sure.
Jim Walsh, up and down the highways, you have motels that are running 25–30% off. These people are willing to sell these places. All you got to do is repurpose. If I had access to $25 million, that could get you 500 homes by this year. There are I got properties already on them. There are motels all over the place that you can go in and basically do what they call a condo conversion. Turn the whole thing, you add a bedroom to each unit, and then sell them as starter homes, sell them as Section 8 people. There are properties all over Delaware. Since COVID, people are not going back to the hotels and the motels. And all these places are barely staying afloat.
Yeah. So,
looking for a way to get rescued.
yeah, you meant more about the data. I think it's more complicated than that, but we'll talk about increasing the supply. Anything else before we move on? Okay, Alex, thank you.
Michael Daniel, DTI. I just want to know what's being incentive like for the lower income housing. How are builders being incentivized in the state of Delaware to build those homes as versus building, let's say, $2,000 rent, $2,000 a month of rent condominiums in like Wilmington versus like $1,000 condominiums in like everywhere else?
Yeah. Yeah, we're talking a little bit about that. Some of that is land use, some of it is subsidy and state and federal assistance to developers to create lower income units. But that is, supply is always a challenge for us. Okay, so I want to move on. Thank you, Alex. And when I think about the different pieces on homelessness that we're charged to look at here, I'm thinking about outreach and navigation. I'm thinking about homelessness prevention because as Rachel suggested, I think that's an area where, if you can keep people out of the system, I often say it's a full-time job to be homeless. And so if you get into the homelessness system, it is that much more difficult to get out. So keeping people from entering the system is to our advantage. The goal really ought to be for homelessness to be brief. Steve, you asked about timing. Brief is the timing that I think we should aspire to, and that rapid rehousing is part of that. That we hope that it'll be different for different people and types of people probably, but that experience is as brief as possible. Again, because the longer you're in an unhoused situation, I think the harder it is to get out of it. But we do need to look at our shelter and short-term housing supply and obviously the supply of permanent supportive housing. I think, what to me is somewhat frustrating about homelessness is we have a pretty good idea. We've been trying a lot of different things over the past several decades, and we tend to know what works. And we also sort of correspondingly know what doesn't work. We know that low barrier access is really important, making sure that we do think of homelessness as a housing problem and that we reduce barriers to accessing support. We do know that time in the system is not our friend, that we have to be more reactive and get people as they enter the system thinking immediately about how we get them out. And I think that's how we'd also need to measure our performance. How quickly do we get someone out of this system? I would rather that we not pay that much attention to, and we're probably not going to do this, and it's probably wrong, but to make the point, I don't know that it matters how many people we have in shelters. To me, what matters most is how many people have we either prevented from becoming homeless or have we rehoused afterwards, right? The shelter system is the Band-Aid in the middle. It doesn't actually, that's not the system that we should be looking to build here. We should be looking to build the system that moves people through homelessness into a permanent outcome. When I look at Delaware, I think about, its strengths. I think that we have some great initiatives happening around the state. I think that there's a lot of attention on this issue. There's a group in Wilmington that Mayor Carney has put together. We are coming back together at the state level. I think there's a lot of coordination. The small state feel is usually an incentive. I think that we have a good system of resources. And even though it doesn't feel like it after that great data presentation, I think we have generally manageable numbers in Delaware. And we ought to be, we're certainly not California, where I think I read this morning that there are 180,000 people who are experiencing homelessness. So our numbers are relatively manageable, although with the caveat that our resources are sort of correspondingly small. And I think we've seen some recent expansion of our system, mostly through taking advantage of COVID relief funds. We've seen the creation of the Hope Center over the last 4 years, the Springboard Collaborative in Georgetown, and some other resources that have been expanded because of the availability of new funds. That comes with one of our weaknesses, I think, in terms of a lot of that was one-time money. And so we're seeing a shrinking of the resources that are available to us. We just recently, for example, had to stop applications coming in for the housing stability program, which was funded through the emergency rental assistance program through COVID. It was going to end in September because of the timelines. We ran out of money a little early, which to me is a good thing. It means that we won't be returning any money to the U.S. Treasury. But that program was able to provide rental assistance to thousands of families over the last several years so that they could avoid eviction. So not having that program available to families is going to be significant going forward. I'm hearing a lot lately about operating funds. The ARPA funds and Recovery Act funds were used to maybe expand our systems, but without the ability necessarily to keep them operating going forward. And that's a huge stress on our system right now. I think we have somewhat of a fragmented system, quite frankly. I think that's one of the reasons that this collaborative is really important, so that we can I think that there's a lot of really good work that happens, but it happens in sort of little pockets around the state. And we don't have a very good way of assessing the system as a whole and to see whether or not those pockets of resources and programs are being effective. And I think that's related to our application of best practices and policies and a focus on outcomes as opposed to short-term services. The way I approach almost everything is through sort of a lens of how do we maximize our resources. And I think that comes down to three things, and primarily whether or not the system has the capacity to do what it's supposed to do, whether it has the operating system within itself to be efficient, and whether or not it has the policies to apply those resources in the most efficient way that leads to the best outcomes. And so that is sort of the framework within which I'd like for us to think about how we move forward with this group, is to think about the different ways that either state agencies, counties, or cities are deploying our resources and making sure that they are contributing in a positive way to positive outcomes for the entire system. So as we move forward here, do we need a break? Have we been going for a while? Should we take 5? Okay. Quick 5-minute break before what I'm going to ask you to do when we get back is to, quite frankly, start our process of evaluating the system. And so all of the members got a homework assignment that was to come prepared to talk a little bit, just 5 minutes. If you're not totally prepared, that's fine. Just give us off the top of your head, how your agency thinks about homelessness, what it does around homelessness, and how it deploys its funding and its resources. So that is, if you didn't do your homework, you got 5 minutes to prepare. All right. Thank you.
I have to ask questions. Everything good?
Yeah, check my camera.
Oh, it's already flipped over to the desktop right there.
The camera's just off.
what your agency is and does in regards to homelessness programs and services. So I'm going to start with Rachel, because you are on that side of the table and you're on your phone. So there you go. So that's a lesson, all of you. Make sure you push the button and we'll just go down the line. Thanks.
Yes, so very briefly, Housing Alliance Delaware became Housing Alliance Delaware in 2016 because we merged two organizations together, the Homeless Planning Council and the Delaware Housing Coalition. Starting many years ago. So the Homeless Planning Council, which was one of our parent organizations, took on the role of being the entity in Delaware to do the things that had to be done to make sure that Delaware would receive homeless assistance money. And that's kind of a role that has stuck with the organization through time. So our organization, so the largest pot of federal money for homeless assistance, there are two main pots. One is the continuum of care. The second is the emergency solutions grant money. We don't control the emergency solutions grant money, but we play a role in determining how the continuum of care money, which, as Matt already said, is about a little over 11 million a year at this point, what nonprofits in the state get that money and to do what. We are kind of the go-between. HUD requires there to be one at this point and has for years, between the local nonprofits who get the money and operate the programs, and HUD. So we coordinate with those organizations, kind of do some performance evaluation and monitoring, submit the funding application to HUD each year. And then HUD executes the contracts directly with those organizations. So we're not actually a pass-through. We do the administrative work to ensure we submit a competitive application to HUD for those dollars in Delaware to try to get as much money as we possibly can to the state of Delaware. For people experiencing homelessness. So we play that role. As I said earlier, we also play the role of HMIS, Homeless Management Information System lead. So every community, again, that's one of those things, as the community that gets those federal funds, we have to have a data system to collect data about homelessness. So we administer that system. We provide training to homeless service providers, shelter providers, who use that system, make sure they have access to it, make sure they're collected, monitor data quality and try to make that data the best it can possibly be. And we have to do it in compliance with HUD's rules about data collection on homelessness. And then we do the coordinated entry work for Delaware as well, which is one of those things you have to have. In Delaware, we call it centralized intake. So those are the three big things that we do. Centralized intake is really about coordinating access to the resources that exist in the state for people who need them, prioritizing people who need them most for the limited resources that we have. In a lot of ways that program has operated over the years has been really designed and thought about from, and I'm not saying this is a good thing, but kind of from a scarcity model. We know we don't have enough resources for everyone who needs it. So how do we as a community prioritize and think about who gets the limited resources that there are? So those are the three kind of main ways. And then we do, and are required by HUD to partner with the ESG, the folks that get the ESG funding, to coordinate that work, to coordinate the work of addressing homelessness. Is that good? Or good? Okay. Did I get an A?
This is a check. This is a
check. Okay.
Thank you. Brandy Nauman. I'm the Community Development and Housing Director for Sussex County. I'm here on behalf of Todd Lawson, our County Administrator. So my homeless component will be pretty brief, unfortunately. So we are not in a direct entitlement from HUD. So we do not receive homeless service dollars, but I do serve on the COC board with Rachel and Susan, and we do offer some grant programs through Sussex County that emergency shelters do apply for, as well as Code Purple, and receive funding with general fund dollars from Sussex County. And I know we're not supposed to really focus on the supply side, but I feel like that's probably more of what I represent in terms of the solution for that. Our Sussex County has recently formed a land use reform working group, and I'm very motivated by the all of the work that is going into this. And I really think we're going to see a lot of policy changes in the county within just probably the next quarter in terms of diversifying housing stock. Because as you said, that 2 units to the acre is just what's, developers are being told to build in Sussex County. And so we want to, encourage that diversity and make it easier to build multifamily and smaller units, ADUs, that sort of thing. So I think there's some hope in Sussex County, but that's my.
Awesome. I really appreciate Matt and Rachel for doing the boring stuff about the COC. You guys have already shared with the group about Delaware Continuum of Care. In 2014, we met in this room, providers, all kinds from every part of the continuum, to say we wanted to work together. HUD mandated it, and whatever happens at that national level with the dollars, we talked about. We're working on a strategic model with Suzanne Wagner about the need for the continuum. We've talked about that over and over today. And Carrie was, I think, our first chairperson. So I appreciate being in the position. I started the Code Purple shelters in Sussex County, so I understand that low barrier and understand the need at a very raw, and I feel the emotions in the room because it's a very raw, but moved into the offering the inventory and continue to be part of the continuum of care because you see the lack of affordable housing. You've outlaid it beautifully. The continuum of care meets bi-monthly as a board. There's almost 20 folks that are on it, and we follow HUD's recommendations of trying to get all the different partners to participate. I want to say it's really critical that it's kind of like a computer, trash in, trash out. If we aren't participating and we aren't bringing to the table and collaborating together. And I appreciate the ditch conversation about how the ditch was working that higher level. I think it was really critical. And then continuum of care seemed like there was a duplication of services, but I can really see a really good blend of, because of those grassroots things that are happening at the continuum of care and communicating at that. We have lots of committees at that level that can kind of, I hope we'll take advice from that, from the continuum of care to this group, because this is the group that has the teeth. I feel like we need to be directive, take action, stop admiring, and I appreciate being able to participate in this committee. I think a lot of work can be done.
Just reminded of something I meant to say earlier and didn't, and I think this group is constituted very differently than the ditch. So I do think that there was a significant amount of overlap in sort of the constitution and the purpose of the that created that overlap, and duplication. I think this membership is very, very tight and very, very specific, and looking at a very different sort of set of outcomes than the ditch did. And so I hope that that's less duplication, although to your point, very much needed collaboration.
Yeah, absolutely.
Hi, I'm Steve Yateman from the Delaware Children's Department. In our department, we're responsible for three main areas: juvenile justice, child welfare, and prevention of behavioral health services. A lot of our work around homelessness centers around the child welfare division, but not solely. We're currently doing three things, two of those in partnership with others in this room, and one is a bit more of a solo act for ourselves. The first two things are making use of the state rental assistance rental vouchers that we get through various housing authorities, Delaware State Housing Authority and our partners. That has been something that's very positive for our families. Specifically, it's really positive for youth exiting foster care. We call it our independent living program. So youth that have been in foster care, aged out, they never reunified with their family, they were never adopted, and they're all on their own at 18. So those vouchers really help us be able to set those young adults up for success. The second program we have with a partner here from Newcastle County is the Hope Center. We have set aside money in our budget the last few years. We actually asked for more this year. We're hoping that will be in the budget that passes in June. It helps us keep families intact. which is a huge benefit for our families, right? When a youth enters foster care, the outcomes aren't always as great as they are if we can keep a family intact. The Hope Center has helped us keep intact families together in a safe, stable place. And they also provide the case management to help those families with other issues as well. The one thing that we're doing more on our own is the case management to use a voucher or help a family experiencing homelessness is a lot. So our caseworkers in child welfare are helping families overcome things maybe related to addiction of the parents, related to searching for jobs, right? Getting steady employment if they've been incarcerated. So adding the homeless case management on top of that was very tough. So we set aside some positions and they just do that for our department. They work on housing case management and take that workload off the other workers there. So we found that to be beneficial so far. It hasn't been going long enough to get a lot of data, but whatever we find, we will share. That's all I have.
Josette Manning, from the Department of Health and Social Services. I have about a 32-page summary of our work in this area. I will not share that. Yeah. So essentially, we touch housing across 9 of our 10 divisions. The Division of Child Support Services has very little touch on housing, but every other division in the department does, including emergency assistance services, out of social services, and our partnerships with the Hope Center. We are expanding. We have a pilot program with the Hope Center that's kicking off where we are expanding the time frame and the funding cap because we recognize that 90 days to find transitional and stable housing is really not adequate. So we're interested to see how that goes. I'm just trying to highlight obviously we participate in the point in time count, complex case coordination, the Dual Gen Center, which liaisons with folks in that community to help them get places through what was the Family Services Cabinet Council. Our long-term care ombudsman program focuses on our aging population and their transitions to their next best places. We have about 333 SRAP vouchers per year, approximately, across the whole department, and they are in DSAM, they're in DSAP, they're everywhere, in DSAPid. And so, sorry, I know I'm using a lot of acronyms, but
Just keep rolling.
yeah, right. I'm sorry. If I try to slow down and say, well, we're going to be here all day. We have group homes. We have homes like Oxford House for folks in recovery. And so those are all pieces of homelessness that really are spread throughout the whole department. So in 2021, the department used the Medicaid funding to do a study on our Medicaid population and what their housing needs were. And last year, we decided to grow that, and we actually got additional funding from CMS to expand that and to really look at creating a roadmap internal to DHSS, but also how it will connect with all of our external partners to streamline that process, including having one point of contact in the department, which we've already established. So we have a complex case unit within that. We have a housing person who is going to be our point of contact. That person you may see at these meetings. But really, it's so big and we touch in so many different places that we needed to get a handle on it. So the purpose of this study and developing this roadmap, which is in draft form, so I can't share it yet, but is really for the department internally to do the best it can, because we can't really connect well with all of you if internally we're disjointed. And so that is the purpose of that project. And I'm just going to stop there because there's tons more, but.
Yes, 10 more seconds. That was great.
You're going to buzz me.
I'll be a little bit shorter. Tara Taylor with the Department of Correction. We at DOC, we have our prison facilities, work release facilities, treatment facilities, probation, parole, pretrial supervision in the communities. We have a whole unit that's dedicated to reentry services and reentry planning. From my seat, some of the main issues with housing that we see is it feels kind of fragmented. So we might have case managers or reentry planners that establishes relationships on their own, but it's in some ways, if you don't have those relationships, you're just trying to figure it out on your own. So In some ways, there seems to be an overlap of services or duplication of resources that are available. And then in other ways, like I said earlier, there's exclusions. Our sex offender population can be extremely difficult to place in the community. Sometimes just having a criminal history alone is an obstacle. And as Josette mentioned, our aging population, especially those that have been in prison for long periods of time, and if they have a medical issue as well, it's a guaranteed no-go. If this group is looking for ways to, I think, make improvements, and we touched on it a little bit earlier, is that long-term planning and figuring out ways to make the wheels kind of flow together. Because what we've seen is sort of this cycle. They get short-term housing, they can't get to that next step, and then it's just in this cycle. And then at some point, I think they just give up and they just stay on the streets. From a supervision perspective, it makes it even harder to supervise somebody in the community when they're homeless. That's why I was always so passionate about placing the sex offender population in a residence. It's so much easier to supervise somebody when I know where they're living, I know where they're sleeping, I can check on them, than when I'm trying to find them out in the community and they're just kind of bopping around. So I'll stop there as well, because I can go on a little bit longer too.
Good morning, I'm Dr. Rudy. I'm going to complete my official title of Education Assistant for different programs and students experiencing homelessness. I'm the Kitty Benton State Coordinator, and I'm here on behalf of Secretary Cindy Martin. Over the last 12 months, several couple of years to the last 12 months, we've been focusing on spending down our American Rescue Plan Homeless Children and Youth Funds. Most recently, over the last 12 months, we partnered with Social Contract, and they did a statewide assessment of our McKinney-Vento state liaisons. You might not be aware that the McKinney-Vento law requires all public school districts and charter schools to have a McKinney-Vento homeless education liaison, and I work directly with them. And they Social Contract surveyed and spoke to all of the statewide liaisons to find out gaps in services, what are their needs are, what are we doing right. They also surveyed some administrators. Unfortunately, we didn't have very many school administrators participate, but we were trying to get that higher level input as well. We also partnered with TAP Network for a campaign, a fan school campaign, and I have a couple of the brochures and some of the magnets that I brought with me. And for example, this one says, "Are you a student experiencing homelessness?" or "Know a student who is." We also have, posters addressed to caregivers. So it's targeting McKinney-Vento families or students who are experiencing homelessness, but the intent is to reach all students. And the QR code directs them to the Department of Education McKinney-Vento website, and the phone number is my direct line. So they have direct contact with a person if they follow this. The second part of our Stand School campaign started a digital campaign that's running April through July. We have digital ads, which are display ads, connected TV, which is streaming, and we also have Spotify ads. And the TAP Network is collecting the data to show that we've actually had a very good response. For example, our streaming video content has received a 99% completion rate, which is higher than the national average of 95%. So it shows that we're reaching people, they're paying attention, and they'll have the same contact information that they have on the paper ads. So then also my work is, as I said, with the core part of McKinney-Vento, working with the schools, working with the McKinney-Vento liaisons. I provide professional development for them, but I also work with them on a case-by-case basis when there's a situation with a student or family who's experiencing homelessness. I also partner with other states, state coordinators. For example, if we have a student coming from Maryland, under McKinney-Vento, they have the right to attend the school of origin or the school of residence where they're coming from. So they could be living here, but the school of origin might be Maryland or vice versa. So I help coordinate and facilitate some of those conversations as well regarding transportation and student best interest meetings, as well as enrollment McKinney-Vento disputes. The liaison's role at the local level is to remove educational barriers to ensure that students are immediately enrolled, and then provide referrals to some of your organizations if there's medical needs or other resources that they might need. Thank you.
Hey, good morning. I'm Carrie Casey with Newcastle County, and I'm here representing County Executive Henry. Just as an entitlement community, Newcastle County receives about $200,000 in emergency solutions grant funding, which, as Rachel stated, goes towards homeless services, rapid rehousing, and shelter operations. During COVID, just to give you a sense, we got like 1.4 million, which was amazing, and we were able to do a lot of really good work. So, we can end this issue with funding because we saw it. We also fund the construction of shelters with our home program investment partnerships funding, which we get about $1 million. Obviously, public safety and public works are very involved in when we have unsheltered homeless. We have a really robust behavioral health unit in public safety that works really closely with us when there is an encampment. And then obviously the big elephant in the room here is the Hope Center. The state has a huge footprint at the Hope Center. It is the Newcastle County Hope Center. However, we exist and operate only through referrals because we need the per night rate to operate. We don't get any Newcastle County funds. We do have some one-time funding that we use, ARPA and CARES Act and other funding as such. So we get direct referrals from 18 different agencies statewide that touch just about every population. 50% of our referrals come from the Emergency Assistance Program through Secretary Manning. We have the wonderful partnership at DFS that Secretary Yateman talked about. Came from an RFP that they were willing to look at. DFS was willing to look at to partner with us, which was huge. And we see really great evaluations with that. We get reentry folks through Delaware Center for Justice and Project New Start. And we get youth exiting foster care through West End. We've also had 5 seniors in high school that did not have, parents. So we were able to get them up and at school every day and graduate, which was a huge thing for us because we have a lot of staff, a lot of moms like me, pushing to get them up. We also have community education building, our Department of Education. They have 5 charter schools. They refer to us. We have the first medical respite program. Christianity Care actually leases the whole 6th floor for people that are stuck in the hospital, but could be discharged, but they don't have a place to go. They lease the whole floor from us per night, which helps us with operations because I'm tasked with operating, making sure we can keep the lights on. And, I do worry about it because we are a patchwork quilt of funding and we want to, as we've evolved from COVID, we believe that this model works, but we just have to make sure that we can operate it. We are statewide. 15% of the households come from Kent and Sussex and are bused from Kent and Sussex every day, which is really challenging for those families. They really have a hard time coming from, Woodbridge High School up to Newcastle County. It's scary. Their support system is in those areas, so it's really challenging. We are at about 80% occupied at all times. To answer your question, we would be 100% occupied if we could take direct referrals from Rachel's group. And all we ask for an agency wanting to partner with us is that they agree to an MOU of understanding, and then they can directly refer clients to us same day. And we keep families together. We don't look at if you're married. We have multi-generational families. We have single fathers. We have mom and dad. We have 21-year-old sons and, adults. Like, we really try to keep the family together. We have a new partnership with the Department of Labor. They come on Thursdays, and we have the state service centers and social services there every Monday and Thursday. So we try and then to get access right there at the point of the hotel. The Bridge Clinic, the Division of Substance Abuse and Mental Health, has been with us since day one. December 15th, 7 days a week, providing mental health referral, substance abuse referral, and access to state services. It is an amazing model, and I can't even begin to thank the state partners for their work with us, and also the fact that we are the only hotel that is shared data with Rachel's, so we can actually see who we serve, which is about 450 households a year. And about a 30% to permanent housing. And that is as good as it's just so hard to find housing on the back end. We have a lot of people that go back with family or going to transitional. So there you go. Sorry, I know I'm past my time.
I'd like to be the one.
I could talk all day, but I just want the state to know, and like the city of Wilmington has funded us. I mean, it's not like a county, it's like a all hands on deck village approach that I think can actually end homelessness. I mean, honestly, I think it can. Just like Code Purple and Sussex could end homelessness. I mean, there's really good models out there that we can embrace. Thank you. Sorry.
I don't think she went over time.
Thank you. Thank you.
So Lucretia Moultrie, Secretary of Labor. So our Division of Employment and Training does a lot of work around preparation for jobs and job matching. So resume creation, identifying job opportunities, assisting individuals with searching for jobs, helping employers identify qualified candidates. And we're also really trying to focus on how we help reskill and upskill workers. That's particularly relevant to the discussions that we had today around the need for, individuals being able to meet that cost burden. So we will certainly have a mindfulness towards that. With regard to outreach, we've already talked about the Hope Center, but we also have our mobile vans, which are really critical. So labor takes great pride in our ability to meet people where they are, as opposed to having people report to the Department of Labor to get those services. In addition to our, I guess it's worth mentioning that anyone that receives unemployment insurance benefits are naturally sent over to employment and training to get the additional support. The Division of Vocational Rehabilitation also provides individualized services for anyone who identifies a disability, so that they're also able to obtain employment.
So, like most small cities around the country, we don't necessarily have social services. Most of what we are chartered to do is focus on law enforcement in the section of buildings and residential spaces, land use planning, development, and parks. And so when we deal with our house population, we tend to depend on being able to wayfind to help direct individuals to state and county funded resources. The majority of the time, connection with a lot of these, or interaction with a lot of these individuals, unfortunately end up being with law enforcement. Because we're dealing with a lot of mechanics, we get phone calls on a daily basis regarding public application, drug use, prostitution, individuals who have their things in public right of way, who are camping out in public right of ways like Robin Square and Front Street and all along the street down by the train trestles and overpass. I'm certain that Secretary Manning has received numerous phone calls from Mayor Carney, and I apologize.
Yes, I have.
But majority of the work that we're focused on right now, I will break up in the short term, medium term, and long term. For short term is how to manage this population that's out here. We're tending to engage with some of the hardest to serve individuals who deal with a lot of drug use, mental health issues and the like, and how can we in any way direct them to alternative places of care and service. Part of that is trying to develop some day shelter opportunities for individuals to get out of the elements. We are currently working to stand up something similar to that, to try to get folks to a location where we can provide service, figure out ways to contain their things or so they can store their things so they're not left cluttering up bus stops and things like that for other residents who are looking to use those services. We have our partners in care who work collaboratively with law enforcement or a team of social workers where we are able to, even in scenarios with law enforcement, they'll probably deal with some of these situations to arrest anybody or to deal with everything solely from a law enforcement perspective. Also, in the medium term, we are working with Mission Land Use and Planning. We are working to look at our zoning laws, as you mentioned, figure out how we can increase density, to increase greater housing supply in the city. Obviously, we're landlocked, so we don't have the amount of sprawling open space that some of the counties and other areas have. So we got to figure out how to get more less. And increasing our density through our zoning policy ends up being one of the areas where we want to focus on. Not so long term is working to create more diversity and the cost of housing availability. Affordable housing is obviously a popular word, as you mentioned before. There is some demand for, units in the city, which is a good thing. I figure out how to create greater self-value opportunities. As mentioned, we offer which are being used to subsidize projects happening in South Florida now, where the old Palmer School is coming down, and we're looking at 30 units in Southbridge, and we're really looking to try to replicate some of that into the future. And so those are areas that we're currently more focused on. So I look forward to working with all of you. As mentioned, we do have a homelessness task force that we have stood up. It is more to deal with this underserved population that we're dealing with, and how to deal with them, and how to work with them and help them refund and try to create this little burden for citizens as they try to take advantage of social spaces. Things of that nature. And it's task force to Black's focus, like we have on housing supply, which is definitely a much larger and broader solution.
Thank you. Eric? Like, it's I'm honored to be here sitting in the municipality. You seem to have the same compassion and dedication to ending this problem that we have in the state of Delaware. We, like the city of Wilmington, have a dedicated department to address the issue of homelessness and unsheltered people in our community. However, Tracy Harvey, who is my community development block grant director, has seized upon some of the responsibilities that we don't have enlisted in our mission statement in the city. She works closely with the folks from HUD and the Delaware State Housing Authority. We help them vouchers, emergency vouchers, shelter referrals, homeowners program, and we're working on this to try to make affordable housing accessible to those people that really need it. I sit here really rejoiced here because we came up, and when I say we came up with three of them who worked for HUD, who just recently retired, helped me develop the mayor's calendar to end homelessness. It continues to be a success. Lost a little bit of momentum, but I think we're going to get that momentum back up. But I think that the template that we use for the mayor's challenge to end veterans homelessness is the template that we might want to look at here, because we were very, very successful, even to the point where the governor, both Governor Markell and Governor Carney, both signed on to it. And we were honored by President Obama and Mrs. Obama because of the success of not only that program in Delaware, but other communities across the nation adopted that program. And if that's my legacy, the success of that program is certainly going to be my legacy as mayor, and something I can look back that we actually got done and accomplished. One of the failures that I've had as mayor is I have established an unsheltered homeless mission in the city of Dover. Today, they've had more infighting than solutions to the problem. And I hope that doesn't happen here And I don't think it will, because I think that rather than people that have tried to make homelessness unsheltered people and industry, I think we actually are going to be dedicated here to solving the problem that we face. And I'm privileged to be here. And I look for nothing but success.
Thank you, Kevin Simmons from Kane County. First of all, Kane County recognizes that homelessness is a growing concern across the region. We're committed to being part of the solution without our capacity as the county, within our capacity of our county government. I want to give a lot of credit to Sarah Keeper, which is our current planning director, that I've had multiple conversations to let her know that I was going to be on this board. She gave me a lot of insight of what the county has been doing, and I know that Sarah is an advocate for the homelessness and affordable housing. And there's things that we've done in the county just within the last couple of months to try to achieve that. First, in terms of direct support, Kane County provides community services grants, organizations of the front lines of homelessness, including the Shepherd Place Housing Alliance of Delaware. These agencies have proven track records of helping individuals and families facing housing insecurities. Additionally, we're preparing to launch a substantial rehabilitation project with the Shepherd Place, funded through our community development block grant funds. So we're looking forward to that. Secondly, we've been addressing homelessness through our policy and zoning perspectives. Again, a lot of work being done by Sarah Keeper with a collaboration with our other core commitments. So with the policy and rezoning perspectives, focusing on increasing our overall housing supply. In December, Levy Court adopted significant zoning ordinance changes, reducing areas in bulk regulations and slightly increasing density inside our designated growth center. These changes will be designated to reduce barriers for housing development, particularly multifamily housing, which is critical to lowering rents and improving access to affordable housing. We understand that this housing crisis is fundamentally a supply issue, and we're taking steps to meet these challenges. So we're trying to step up to the plate within our county government and work on these things. At the same point, I want to be clear about our limitations. Kane County does not have the infrastructure or funding to operate direct service providers, unlike other larger jurisdictions. Operating shelters and transitional housing facilities incredibly resource intensive and outside the scope of what we sustainably manage. With that being said, we're committed to supporting and partnering with non-for-profit providers and CDC that are equipped with taking on this role. So again, we want to be a partner to everyone. I'm glad to have a seat here on the board. Thank you very much.
Well, thank you everyone for everyone gets to check plus. Thank you for your participation today. We're running up on time here. I will open for public comments in just a minute. I just wanted to sort of give you a little sense of where I'd like this group to go. And while today we all talked a little bit about what we do, we'd like to figure out exactly what that looks like in much more detail. So we will at DSHA put together some sort of a way to collect information about the programs that you are running that serve people experiencing homelessness. We will try to get to some of the critical policy areas that you that sort of govern the deployment of those resources around the state, and then we'll bring that back to this group. I think in the next meeting date.
We were hoping in July.
And what that does is gives us about 30 days to collect the information from you, and then 30 days to try to figure out what it all means and bring it back to you in the early part of the summer. Over the summer, I would like for this group to sort of sponsor some public input, some listening sessions around the state. We'll set them up, and those of you who can attend, that would be great. If you can't, we'll make sure that we collect notes and distribute that and get public input. The goal of bringing together this group and thinking about the programs that we run and administer and how we do that is so that we can have an understanding of that and then improve it. So that's sort of phase one to me, is getting over the next 60 days a good idea of how this system is currently working
And then we can identify how it isn't, make some changes, and identify the gaps. The governor, in his executive order, gave us a charge of reducing homelessness by 50% and ending childhood homelessness. Those are lofty goals. And I think that's where we should be aiming. And I think this process will help us to get there. It also requires that we submit a report of our recommendations in early January, which gives us then sort of the time to over the next 60 days to look at the system. I'm thinking the next 60 days or so, maybe 90 days after that, will allow us to analyze and make some recommendations and start to implement some changes to the way that we work and how we work together and how we deploy our resources with the goal of ending homelessness for people who we serve. That sound good?
Recommendation, the survey piece of it, there might be some value in listening to survey the people that work to place. So the case managers, maybe a probation and parole or at Josette's department that are working with the population to find residents for them.
Yeah, yeah. Yeah, we'll try to layer that in. I appreciate that.
If I may add something to keep in mind, representing schools in the 22-23 school year, we had 4,423 students in the enrollment.
No, I'm not going to do it because we're at the end of our time. My wife spent 15 years or so as a school counselor, and that was one of all of the things, that was one of her major frustrations was working with kids who were experiencing homelessness. And so she would bring that home and we'd talk about it at night because she had a housing policy guy at the table that she could unload on. But clearly something that we need to work on. It doesn't help that the federal government has two different definitions of homelessness, but we can work through that here, I think.
I just wanted to add something that I should have mentioned during, when I was talking before, which is when, just real quickly, something that the Continuum of Care is currently working on, which I know Susan brought up, but by August, we're planning to have, so I'll just say September. We're planning to have somewhat of a blueprint from the perspective of the COC in terms of what the need is, what the gaps are, and some recommended best practices that I'm hoping we can bring to this group and share that will help guide some of the work. So thinking about community input, we're already working on something specifically to bring to the group.
And I appreciate that. And the Continuum of Care is working on it. I think we have great allies in, I know that Social Contract has done some work at DHS, maybe DOE, and has laid some groundwork there. The University of Delaware, obviously, with Dr. Metro is very interested in homelessness and knowledgeable and best practices. I think we have a lot of other resources that we'll bring together from outside of this particular membership group. And that includes, members of the public, and why I want to go out also to have that sort of public listening session, but we'll bring other people in to this conversation to help us out. It is not something we're going to solve among the 15 members of this group. So anything else? If not, I'm going to turn it over to public. Sorry. No. So I presume, Joe, you want to add anything to start with you? Sure. And just make sure you're green. And I'm going to keep you to about the 3 minutes that we were working on there.
We're ready. My name is Joe Walls. When you talk about private power, you talk about shelter, clothing. If you need medical care, we can get you medical care. If you need food, we can get food. If you need housing, you're on your own. DOC does an excellent job now preparing for the prison. They got no place to go. Hope Center, they have a great program. They get their people off the street, many boxes, you talk about how you triage. They don't get them off the street, get them medication, get them whatever program they need, and then move them on where? They know where to move. We have programs that work. We don't have to reinvent it. What we have to do is have courage to take somebody like the Hope Commission or DOC and start implementing these programs across the board. We talk about veteran homelessness. Come on. Most veterans that are home combat veterans, they come home traumatized. They're incapable of taking care of themselves for a period of time. We have an obligation to take care of it. It's not them, it's not those people, it's us. I was homeless. Talk about our brothers or sisters or children or parents or home. We have the resource. We're just not expending the resources in areas that are proven to be successful. And that's the great thing about this interagency, because everybody's at the table. You can forget about your personal agenda. You come up with one goal. One goal. No one in the state of Delaware should be homeless. Thank you.
Well said. Anything online?
Not seeing anything right now. If anyone online would like to make public comments, raise your hand.
I've been recording and taking notes. We'll make sure that some minutes get out to folks. We follow this fresh.
Seeing anything?
No other public comment? The next homework assignment will be that deeper dive into what the system looks like today and what opportunities we have. And we'll come back together.
Thank you.
Thank you.